The first study into the nationwide vaccination program for cervical cancer suggests it could be having a dramatic effect. The rates of pre-cancerous lesions in girls under 18 have halved since the vaccine program started in 2007. Victorian researchers say it shows the vaccine is working, but there's more work to be done to find out if it's the vaccine or pap smears that are behind the results.
Australian girls and women were the first in the world to take part in a vaccination program for the human papilloma virus. Since it started in 2007, there's been a dramatic drop in the incidence of genital warts. Now it seems the vaccine has halved the rates of the lesions that lead to cervical cancer.
We've gone from about 1 in 100 of these young women who are being screened having a high-grade cervical abnormality diagnosed on a biopsy to now less than 1 in 200.
The study involved examining more than 6 million records at the Victorian Pap smear register. The results were most startling for women aged under 18.
The vaccine actually is only effective if you haven't already been exposed to HPV. And once young women start becoming sexually active, they get infected quite quickly.
Researchers say the study is further evidence that young girls should be vaccinated.
These results are really in line with what we expect, and all the indications are that the program's working as expected.
But it's unclear whether it's all down to the vaccine or because they'd had pap smears. Experts say it's too early to make too much of the study.
Because we don't know which of these girls were actually vaccinated and which weren't, and how many of these girls who came up with abnormalities had been vaccinated, we really haven't linked the data yet.
And that's the next step, linking the National Vaccine Register with the Pap Test Register. Rebecca Barrett, ABC News.